Hello friends, I'm back once again with a new topic. Last time I spoke to you about peripheral arterial disease, and today we will talk about another burning topic, clots and COVID. I hope all of you are taking care and keeping yourself safe from the viral infection. Now, there have been a lot of news items which are talking about clots in COVID infection. Just to understand that when it comes to COVID, we are dealing with a beta coronavirus belonging to the SARS coronavirus family, which caused the SARS epidemic in 2002, 2003. Now, these are some of the reports I was talking about. COVID causing blood clots in patients. Coronavirus attacks blood vessels, creates strange clots. And these were seen in autopsy studies, especially a lot of them coming from Italy. Then blood clots in the lungs may be a major cause of death. And people have been talking about, is it really a clotting disease rather than a respiratory disease? And then talking about a blood clot test, which could save lives. These are the other things that we come across. Purple hands or fingers, purple toes, or what we call COVID fingers and COVID toes, leg swelling, severe leg pain due to ischemia, and sudden death, where a clot goes into the lungs, blocks the circulation completely, and results in sudden death of the patient. Now, what is clotting or thrombosis? Thrombosis is the medical term. It is the formation of a blood clot, also known as a thrombus, within a blood vessel. It prevents blood from flowing normally through the circulatory system. Now, under normal circumstances, formation of a clot is a protective mechanism. So when you have a cut, the thrombus forms or the clot forms to stop the bleeding. But when it forms within the blood vessel, it can be a medical problem. Now, 30% of patients with corona infection who are admitted in ICUs develop blood clots. And 80% of these are in the lungs. And this can be a real emergency and can be a sudden killer. Now, how do we know if somebody can develop clots? So if a person has corona infection, is he prone to developing blood clots? So what we see are the elevated levels of D-dimer, which is a protein fragment in the blood. So if the D-dimer is elevated, it indicates that the person is at a high risk for developing blood clots. Other markers are elevated platelets and elevated levels of serum fibrinogen. Now, why do clots form in patients who have COVID infection? Now, to keep it very, very simple, now the coronavirus enters the endothelial cells. So these endothelial cells are ones which line the blood vessels and normally prevent clotting. So when the coronavirus enters these cells, because of the presence of ACE2 receptors on them, they destroy the cells and also make the cells thrombogenic. There is also activation of what we call the complement pathway. And this too triggers thrombosis. There is production of oxygen-free radicals, and all these combine to make a person prone to thrombosis, and you see these clots here. Now, if you have a person who has a coronavirus infection, combine that with obesity, diabetes, high blood pressure, kidney disease, increasing age, this makes a heady cocktail for severe clot formation. And these are the patients who would be at a maximum risk for clotting in patients with coronavirus infection. Now, as vascular surgeons, what do we see in practice? We see patients with deep vein thrombosis where clots form in the veins and they could present with leg swelling. And if the clots migrate to the lungs, then they come with severe respiratory distress or shortness of breath. We see patients with acute limb ischemia where clots form in the arteries, and these legs can be at a high risk for amputation unless we do emergency surgery. Patients can have stroke or paralysis due to clots in the carotid arteries. They can present with abdominal pain because of clots forming in the arteries that supply blood to the kidneys, the intestines, or the spleen. Now, these are a few angiography images. These first two are CT angiograms. Here you see a clot hanging in the aorta, which is the main artery in the abdomen. And this clot has now broken off from here, and come down into the artery behind the knee. So we did emergency surgery for this patient, removed the clot, and fortunately the patient has done well and is walking now. Similarly, you have a patient here with clots in arteries behind both the knees. And this patient too underwent emergency surgery, and we were able to save one of his legs, but the other leg was beyond repair and we had to do a major amputation. This is a CT angio showing a clot in the artery at the right elbow. And this patient too underwent emergency surgery and the hand was saved. A couple of examples. So here you have a patient with acute ischemia of the right leg or sudden cessation of blood flow. So here what we did, we exposed his artery in the groin under local anesthesia. And then we put in a balloon catheter and removed this large clot, and the patient did well. Another emergency surgery, again, we made a right groin incision. We opened the artery and you can see the large clot that has come out. And then here you can see that the artery has been repaired. And fortunately, this patient too did well. So in the last 3 to 4 months, we've seen close to 30 patients coming with various forms of arterial occlusion. Another procedure that we do is what we call image-guided thrombectomy. So here you have the aorta, the right iliac artery, and you don't see any flow in the left iliac artery. So we pass a guide wire, and then over that we pass a balloon catheter, and here you can see the balloon is inflated and slowly pull it down. And the clot comes out with that. And then you can see that the flow has been reestablished. Now our suggestions for anticoagulation: any patient with COVID infection who gets admitted into the ICU should have a prophylactic dose or a preventive dose of blood thinning medicine or anticoagulant. If the D-dimer is elevated, there is no question that patient should have a full dose of anticoagulation. Quite often, the medication will continue for about 4 to 6 weeks and stop once the D-dimers return to normal. In patients who undergo surgery, they would require treatment for up to even 6 months. Now, if the D-dimer is elevated, and whether patient is in the hospital, in the ICU, in the room, or at home, anticoagulation should be given. Another form of therapy is what we call the clot buster therapy. So this is especially for patients who come with sudden shortness of breath due to clotting in the lung arteries. And this clot busting therapy using tissue plasminogen activator or TPA is extremely useful in dissolving this clot and making the patients better. Meanwhile, please take care, keep yourself safe, educate your family and your friends, let your mask be your vaccine, and make sure that you use the mask correctly. It should cover the nose, the mouth, and come below your chin, ensuring that the mask is actually protective for you. Take care, be safe, and we will meet once again with another disease or another vascular disease to discuss with you. Bye-bye.